We are live. Tell everyone who you are, please.
I am Dr. Tara Pridgett.
And you're a pediatrician?
I am a pediatrician.
And you're a
certified pediatrician, 23 years.
23 years,
Yes.
Okay. Let's go back and talk about what kind of a pediatrician you were and what happened and where you are now.
So I had all the traditional training. I went to medical school, did a residency program, was pretty much whatever the AAP said was our standard, American Academy of Pediatrics. That was our standard of practice. And
What about vaccines? What was your training on vaccines?
How to use the schedule. Primarily, that was the training. Not so much about side effects, risk factors, who should, who shouldn't. This is the CDC schedule. These are the ages at which we typically give this. This is how to use the catch-up schedule. That was primarily my training, and how to the vaccines.
Did anyone at any point in your class or whatever you call it question that are there any side effects or anything, or do you not remember? No?
Not that I remember.
We just did as you're told.
Yep, did as I was told. Yeah. So practice for many years. I just kind of as a free thinker, and allowing families to share kind of different things they wanted to do, or in terms of just health management. I was agreeable to that. So I actually kind of started families coming in that didn't want to do traditional vaccine schedules, and I was receptive to that because I believe in ultimately I just believe in a parent's right to choose for their children. I view myself as someone who partners with the family, and I don't like to tell you what to do. Just like as a parent, I don't really want you telling me what to do. You can give me advice and I can decide that way. But so I was open to just kind of hearing alternative options that parents wanted to use, and was doing that. So I had a reputation of being one of those providers, and I had a lot of families that didn't vaccinate, families that did some things and not others, and families that did everything. And that was fine in the practice I was in. We were all considered autonomous in that regard, even though we were under the same roof working together. But every person has their own personality and style of work, and so that was what I was doing. Got to the point where some of the partners in the practice, I was not a partner in the practice because I was a part-time provider, because I also had a family of my own, and I wanted to be mom as much as physician, and so I didn't have that pull in the practice. But there was a vote that came up about how we were going to handle kids that were not vaccinated, fully vaccinated, and the partners decided everyone follows the CDC schedule, or you don't remain a patient in the practice. Of course, barring you don't have a medical exemption. So when that happened, I felt like I'm not able to practice in the style that suits me, so I don't have autonomy, and that was my kind of journey to leave.
What year was that that they decided?
2019, right before the pandemic. So it's an interesting thing because we didn't know COVID was coming, but it was coming, and it was just interesting in that time out of practice, because when I resigned from the practice, it was December of 2019, because I wasn't leaving the state, and my intention was to open an independent practice. My contract required me to not compete for a year, so I couldn't work in the same community for a year, not knowing COVID was coming. And just in that time, as the mandates were coming along and the masking, and I'm like, am I in the twilight zone? Because we're not following things that we learned in terms of science, what masking is designed for and how effective it is and isn't. And so it was just more eye-opening. And so when I knew as I was planning to start my new practice, how was I going to do it differently? So what I do is a direct primary care model. I don't fool with insurance because insurance dictates too many rules about how you can take care of people. And I really wanted that dynamic to be just between myself and parents and patients, to be able to determine what is best for them. And Hence, I went independent and opened my own practice in April of 2021, and have lots of healthy, unvaccinated patients as a result of that. So
I
I
bet you
just
do.
really believe, parents get to decide, and I want parents to have informed consent with whatever they're doing in the care of their children, from deciding on a medication or a procedure, and to understand the rationale for why or why not to do something. And I think that's key to giving good care.
When you were at the other practice, or even the practice you're at now, did you see parents come in and say, listen, my child had a seizure following vaccines, or this or that? Did you start to see the injury coming in?
If most pediatricians are honest, they've seen injury. I remember a particular instance where a young lady I'd seen all of her life from birth up. She's mid-teens at this point. Mom came back in with concerns that she was having some neurologic problems following the HPV vaccine. And this mom especially wanted to meet with myself and one of the nurse practitioners that I worked with to just share that her concerns that there's something different here and my child has been impacted. And even with seeing that, there was that initial, just based on my training, the original training, that for the greater good, I'm sorry this happened, or it seems, I'm not going to deny that there's some changes for your child. She wasn't walking normally like she had been before. She had weakness, fatigue, conditions that because I know I've seen her over the years. This has been a fairly healthy young lady, and now we have a change. So I couldn't deny that I had seen a change in this individual. But even then, there was a little bit of hardening because of the training that you're told, well, we do things, it's not that something bad never happens, but for the greater good, we're supposed to continue to do this. So that mom, she was very compelling, and she's like, I'm not telling people not to vaccinate, but I just want you to understand this is what happened to my kid when we did this. And so initially, again, there was some kind of hardness of heart, but then just really over time, her story always sticks out to me as I think about what I do now in terms of acknowledging that parents, should know what the risks are. I didn't even know what the risks were at the time. The pharmaceutical reps come in and they say, this is what's recommended. This is the ages that we promoted. If you get it by this age, it's 2 doses. If you wait till this age, it's 3 doses. Those were the kind of details we were given, but not really any information on safety.
So, as a pediatrician, do you see any difference between the vaccinated and the unvaccinated children?
Absolutely. The unvaccinated children are by far healthier, happier, bright. I see those infants, and they are bright, they are curious, they are absorbing things, they're just enjoying good health. I don't see a lot of the things that we now attribute to common childhood illnesses. I just don't see a lot of them in the unvaccinated kids that I see.
And in this new clinic that you have, or whatever you call it, do you have as much SIDS?
I've not seen, fortunately, even in the other practice, I didn't see many cases of SIDS, but in my 2 years with the new practice, I've seen 0.
Well, what advice as a pediatrician would you give parents as we go into the fall, winter, where we know the media hype is going to be intense for RSV and kids are going to get sick?
Yes.
They did in my era,
Right.
and they're going to again.
Right.
What advice do you give them if they're choosing not to vaccinate? What advice to not fall for the fear?
To, 1, trust your instincts. 2, ask questions. It's partner with people that you feel respect you and are open to hearing your concerns. Talk to the elders in your tribe or in community who can reassure you that these things are normal. expect that children will catch infections and get colds, and they also recover beautifully. I try my best to not intervene and let nature take its course. There are times when we need to do interventions, but for the most part, if you can keep them hydrated and comfortable, this too will pass. And that's kind of my advice.
Don't do what I did as a mother, which is rush to my pediatrician with my babies every time they sneezed and get more antibiotics and more antibiotics.
I don't subscribe to that at all. Infection is part of the body's process of maturing, and babies and children get colds and viruses, and I really just have, in my own practice, I have a my outlook is that I don't give a lot of medications, and I don't encourage a lot of medications, and again, the keys are hydration and keeping them comfortable and being patient.
You know what we want to do? What we should do is get a whole box of Brian Hooker's Vax Done Vax books for in your waiting room, in your surgery. Vax 2 piled up. Educate yourself, these young parents.
Absolutely.
Well, I'm so honoured to be sitting here with you, because there's nothing more exciting than a good paediatrician. I don't meet very many of them, but I'm so grateful to you for the work you're doing, looking after the babies and all the healthy babies that we're seeing.
Thank you. And I just wanted to share that there are good physicians out there. It's been a challenge because you hear people talk negatively about doctors, and very much warranted, but just know there are some bright lights out there.
Yeah, I'm sorry about the negativity. When I tell people stay away from pediatricians, I still stand by that, unless there's someone like you, because honestly, you're the frontline people we go to with our most precious gifts, and they're dying, or brain injured, or paralyzed, and the outcome is not good. So when we do find a good pediatrician like you, we're thrilled. So thank you, and thank you for being so brave to do that as well. Must take a lot of courage. I'm sure you get a lot of trolls on your back, and you certainly will do after this interview. Thank you.